Hello everyone. Today in this video, I'm going to be taking you through our Missouri COVID-19 Vaccine Navigator. Now, the purpose of this video is to show you not only what the typical respondent will see going through the survey and what the typical person will see, but really to try and get at some of the potentially more different, weird use cases where the survey might not respond exactly as expected, even though it is intended functionality. Again, this survey is built to be as user-friendly and as easy to work with as possible. However, I'm just going to be talking about some of the questions that you might have going through it, or some things you might not understand just from taking it once. So here we have the opening page, and we again have this first display message that every respondent will see, and we can just go ahead and go through this and go to the next page. Now, the first question that we're going to see for every single patient is that have you previously received a first dose of a COVID-19 vaccine? And this is simply to, essentially better understand if someone has gotten a COVID-19 vaccine outside of the Vaccine Navigator. If they have received a dose at a hospital, at a pharmacy, whatever, that was not through the Navigator, we need to know to update their first dose to 1 and have it know that they only need a second dose for this. So if we say yes, we come to this display message, which essentially just says that we highly recommend that you schedule your second dose through the same organization as you got your first dose. However, this is not necessary. This is not 100% mandatory, and the respondent still can go forward, proceed with this, and get their second dose to the Navigator. However, like I said, if we do say yes to this, we're only going to be set up to receive a second dose. So for now, I'm going to go ahead and approach this as no. Then we get to very basic contact information. And again, let's talk about date of birth for 1 second here. There are two main things that date of birth will give us here. Based off their age, and again, obviously based off their date of birth, there are two things that will change how they go through the survey. If they're younger than 16 years old, then we'll collect a little bit more information from them. And then tell them that they are too young to be vaccinated at the current moment, and that we're not going to, continue on with the vaccination process. So that's for everyone 16 years and younger. However, if the person is 65 years and older, what this will do is this will automatically qualify the person for Phase 1B Tier 2. Now, if the person is a healthcare worker, or part of a critical infrastructure worker, say a fireman, they could still qualify for one of the higher tiers, like 1B Tier 1 or Phase 1A. For now, once we understand that, I can just go ahead and pick essentially an age in between those two ages. With this email field, it will require, if you enter something, to enter in a real email, or not necessarily a real email, but something that has the structure of a real email, like this, with this sort of thing. Going here is that, again, we primarily want everyone to enter in an email because that makes it easiest for the Navigator to reach out to this person and have them schedule their future appointments, or be told that it is now time for them to schedule an appointment, or we have vaccines. It's our preferred way of communicating with these people. However, we do recognize that not everyone has an email or a cell phone. So if you don't put in an email or a cell phone, you'll be taken to a next page where it asks you for a landline number. Unfortunately, right now, if you don't have an email, a cell phone number, or a landline, we don't have a way for you to schedule other than finding another person who can have access to one of these things and having that person assist you with the survey. So I'm going to go ahead and proceed with a cell phone number and an email. Again, these are not my emails because I'm just going to be going through the patient registration surveys. if I was putting in my real email, so I would actually receive these confirmation emails and further links to schedule, I would obviously want to put in the email that's actually real. And sorry, this is a good point out here, is that I put in some gibberish both times, but forgot to copy it. We will still have validation that says that these fields need to match. And if I did the similar thing where I made the cell phone numbers not match, we have this error here as well. So then with contact information, this is pretty self-explanatory. Just filling out some basic information here. One thing that will be important is that from county, we will have this one feature that's an autofill feature. So you see I typed in an H there, and now every county with an H in it will pop up. This will be important because we are using the resident's region to show them what events that they can schedule on. As of right now, based on your county, whatever larger highway patrol region of the 9 regions we currently have identified in Missouri, if you are in Harrison County, you'll be in one of the Region A, Region B, Region C, and at the current moment, you'll only be able to see events in your region. We're working on, for future cases, also being able to see events that are close to you, but not necessarily in your region. But as it stands today, you will only be able to see events in your region. So again, putting in a fake zip code here, and you can see these red asterisks mark the questions that you must fill out. So again, you can leave address 2 blank, but you cannot leave address 1 blank. From here, we take it to some basic ethnicity and demographic questions. Again, one thing to call out here is that this is a mandatory question, but the patient, if they would not like to, can either specify none or refuse this question. For now, we can just pick any random combination, and we will just record this data to ensure equitable distribution of the vaccine and to track what communities we might need to be doing better in, what communities that we're doing poorly in, et cetera, et cetera. Same example here with gender. It is a required question, but you can prefer not to answer should you so choose. Here we finally get into our assessment portion of the survey, where we're not just collecting data on everyone. We're trying to figure out who should be in which tier. So one thing I will call out but not go down this path is that if I do say that I am unemployed, you will only receive 1 other or 2 other questions that could possibly place you in a different tier. The first one would be the tier 2 criteria based around comorbidities, that if you're unemployed but you have comorbidities, or if you're unemployed, like I said earlier, but are above 65, both of those would qualify you for phase 1B tier 2. You'll be able to answer a question, on the next question, based around whether or not you have those comorbidities. However, if you are healthy and unemployed, there are 2 groups. You'll see a question that'll ask you, are you one of the following 2 groups? And they are either homeless or disproportionately affected groups. And if you identify as either of those groups, you will be in phase 2 of the vaccine rollout. So not phase 1A or 1B, phase 2, but it is still above the final phase of being phase 3. So moving on, I'm going to say that I am employed. And then we get to this question based on private event or employer code. If this is for the use case of eventually we want to start vaccinating frontline workers, whether they work at the Home Depot or McDonald's or wherever, we're having a specific event just for these people so that we can get some targeted groups vaccinated. So we see this note here that everyone will see is that you do not need a private code to register or schedule. If you do not have a private code, please select no. So again, if I said yes here, it would just take me to a next page asking me to enter in my private code and give me 2 fields to enter the private code to make sure they match. But for now, I'm going to go ahead and say that no, I don't have a private code. So here we get to our 1A questions, asking if you have any of these patient-facing healthcare criteria or long-term care facility criteria, if you're a part of any of these groups. One note is that if you say yes to any of these, you won't see the rest of the employment questions. We're going to place you in Tier 1, and we're going to, list that as your employment information. That's all the employment information that we will collect. You'll only see more employment questions if you select none of the above. So let's say that I am not a part of these Phase 1A groups. We get to the emergency services groups. Now here we have 4, broadly defined categories with explanations below them. So again, like first responder, what exactly is a first responder? Does that include firemen? Yes, it does. Not that I think most people will get too confused by that, but just trying to be as explicit as we can. So again, these are Phase 1B Tier 1 groups. Again, we just saw Phase 1A groups. Now we're in Phase 1B Tier 1 groups. So let's say I'm not a part of these groups as well. Here we get to Phase 1B Tier 3 groups. And I know it might be a little bit confusing, but the idea was to try and keep mostly the employment questions together and the health questions separate. However, here we go into all of these groups where we have descriptions of any of them. You could say you're part of the dam sector, part of anything. I am going to continue saying that none of these groups define me for the moment. So here we get to a question about age and medical conditions. So here, based on your date of birth earlier, we display your age. So as you can see here, as someone who's older than 16 but younger than 65, their age does not qualify for them for anything special. But we do ask about the following medical conditions. If you have any of these, if any of these describe your medical status, whether it's diabetes or cancer, if you have any of these conditions, you select yes, you'll be in part of Phase 1B Tier 2. Let's continue on and say that no, I'm not a part of any of these groups. We finally get to our final question surrounding employment type. Let's say that here I will finally say yes and say that I am a part of the critical manufacturing sector. Now, if I had said none of the above here instead of the critical manufacturing sector, then I would be Phase 3, based on the criteria we've seen here. Finally, we're getting towards the end of the survey here, as you can see by the progress bar. Even though it seems there's a little bit of a chunk left, there's not too much. We can select our insurance status and note that this will not affect your priority status or your ability to schedule a vaccine. So let's say that here I do have private or employer insurance, although nothing would change if I selected any of the other options. So here we finally get to a long list of health screening questions. So these here won't directly make you qualify or be disqualified from the vaccine. However, if you do go forward, there will be some warning messages, and there will be some of this information present to the person who will eventually vaccinate you at the actual vaccination site. So to ask you questions about, have you had previous reactions to something like an EpiPen or previous reactions to a vaccination. So I can go ahead and say yes to this, yes, allergic reaction to food, just to see what happens when we do this. Once we can see here is that because we selected yes up here, we get this error, this warning message that says if you've had a previous allergic reaction to a vaccine or immunocompromise, it's recommended that you schedule your vaccine appointment with your primary care provider. While this is a warning message, it will not prevent you from moving forward in the survey, as this person may have first tried this and is using the Navigator now that they have been having difficulty finding the vaccine. I'm going to click yes to this question as well because it will ask you what was the date of your last, passive antibody therapy. And here we see the are you breastfeeding or pregnant question, and that's simply because That's simply because earlier we selected that we were not male. So any of the, with the gender questions, if you selected that you were male, you will not receive this question. If you selected any other group, you will see this question. And if you select that, yes, you are pregnant or breastfeeding, you are the person who is vaccinating you will be able to see that at the actual vaccination site. And we have, again, for more information, click here. So anyways, we get the follow-up question because we said, yes, we had an allergic reaction to a vaccine. I can just say that, let's say the flu shot was my vaccine. And that the food I am allergic to is peanut butter. Now, that wouldn't be particularly concerning for the vaccine, but it is better to have this information than not to have it. And again, here we do see the, please enter the last date we received the, passive antibody therapy. So you can put in a date, and this date will be displayed to your, person who is vaccinating you at the vaccine site. So finally, here we get into our last questions around privacy practices. So you can see here that we have this message here with a link to additional places they can talk about. This one's specifically related to privacy of data, and it will we said earlier that our name was John Doe, so John Doe will appear here, and I can click I do agree. Now let's just see what happens if I click I do not agree. Is that we go to this page here, and it tells you must agree to schedule vaccination. Please go back and change your answer. But if that person feels strongly that they do not agree with privacy practices, they can continue forward to end the survey. And if they did that, that would mean that their information would not be recorded and we would hold none of their data. However, I do want to finish the survey. So I'm going to go ahead and click agree. And we get to the second COVID-19 specific consent form that simply states, all of these information here with, again, more information expressly about Moderna and the Pfizer vaccine. Obviously, as we have, future vaccines that do get approval, their information would be added as well. And then we get to the statement down here that, I, John Doe, certify that I've answered all the questions in this form truthfully. Because genuinely, with the policy we have here, we are going on the honor system with this. So they accept there. And we finally get this, display page here. We get told that, this person has been grouped in phase 2. And that makes sense based on everything we selected. Is I think we said we were part of the, chemical or sector or manufacturing sector. But we were in one of those phase 2 groups. Now, again, if let's say that, there was some sort of error or some miscommunication on what this person thought they should have been grouped in, or let's say that they technically are a, tier 2 or, healthcare worker, they just got confused earlier and answered the questions incorrectly, we can say that they can call our call center at this number, talk to a representative, and if they, do qualify for the vaccine, or earlier than their group, they can talk about it there. So the last, most important part is that people do click this last button to submit their information to our contact list. Because once we get this, they will then be able to go ahead and be contacted by us for their vaccine in the future. So this is a good overview of all the things you might be considering for a patient going through the COVID vaccine navigator. And if there are any more questions about this, again, our team is always available to answer anything that I might have not made explicit here. So thank you very much for your time.